The world just expanded its basket of jabs. WHO approves Covovax for emergency use listing. Vaccine produced by Serum Institute of India to turn the tables against the invisible enemy. At a time when the world is grappling a double mutant variant of COVID-19, Covovax approval comes as God sent. The vaccine developed by Novavax Inc. and manufactured by SII will also bolster COVAX, an agreement which brings governments, health agencies, scientists and public sectors together to help poorer and middle-income nations. The approval also heralds hope for low-income countries and middle-income nations. Another important development is that Covovax can immunize kids too. But SII CEO Adar Poonawalla said that the kids' version of Covovax will be ready in 6 months. Covovax targets spike protein on SARS-CoV-2. The developer used cells of a moth in lab to engineer copies of spike protein. Immune system recognizes spike proteins and builds immunity. 96.4% efficacy against mild to severe disease. Efficacy of 83.4% 2 weeks after first dose. Well, the vaccine seems promising at a time when Omicron is slowly gripping the world.
Most certainly, since Omicron has already spread to over 75 countries in such a short period of time, having a vaccine that can reach out to the most underdeveloped countries in the world and provide another option for rapid vaccination with just a 21-day gap required between the 2 doses can make a world of difference to our fight against the spread of COVID-19 around the world.
What's even more encouraging is the fact that kids can get jab too after 6 months. So, what's the composition of the vaccine?
So Covovax is a vaccine that's called a protein subunit vaccine. Essentially, the virus spike protein is merged into a non-threatening virus and replicated, from where the spike proteins are then harvested, and these spike proteins are then put into what is called a lipid nanoparticle along with an adjuvant molecule called matrix M, which provides it an enhancement in the vaccine efficacy. So this is a very unique vaccine. We do not have anything like it currently in the market.
Health experts across the country have put their faith in Covovax. Anurag Agrawal, Director of Government's Genome Sequencing Monitoring Agency INSACOG, said the vaccine induces a strong immune response. A comparison of sorts was drawn between Covovax and Covishield. Experts say that Covovax is a better booster than Covishield.
That is a question that we have not yet answered. Research will need to be done if the Covovax vaccine can be used as a third booster following Covishield or the mRNA vaccines. Remembering that these are still all spike protein based vaccines, though of a different nature, where in Covishield the vaccine contains a chimpanzee adenovirus which carries the signal for the body to make the spike proteins, whereas in the mRNA vaccines it's the mRNA that carries the signal for the spike protein preparation. But in Covovax you have ready-made spike proteins that are provided by each lipid nanoparticle. So I think that they are all ultimately providing the same immune boosting, so it may be interesting to see what booster doses with this might do.
Just a year back, we didn't have a vaccine against COVID-19, and now we have a plethora to choose from. Although vaccine availability to poorer nations was a concern, Covovax is a hope to bridge that gap as well. SII promises to deliver 1 billion doses to financially weaker countries very soon.